cosmetic procedures, and also the aesthetic procedures that are most favored by most of the public. And in addition to that, because of our specialties, we are also able to provide acupuncture services and anesthesia services. So we do have a large range of services available.
So not just a med spa. What would you say makes you unique as opposed to just dropping into your local med spa?
Sure. The one thing that we're able to offer patients is everything from minimally invasive to as most invasive procedures could be. What really distinguishes us from most other facilities is the fact that we're able to do our in-office surgery and with the comfort that is expected by most patients, because Dr. Lee is able to provide them with the anesthesia for that. And so all our services are under the best of circumstances from the patient's point of view.
Okay, wonderful. So, and also, there are all the services that would normally be provided at a med spa. So we're going to talk about some of those. What are, a lot of people got used to the term plastic surgeon, and that was something that I think people steered away from as a term, and there's a reason for that. That plastic surgery, there are many much better alternatives to you do the surgical procedures, but plastic is less of is an old 70s term. Am I correct in saying that?
Very, very true. It's very correct, and we really don't use that term often to designate surgeries that are with the purpose of improving the aesthetics or the looks. We refer to it as cosmetic surgery. Many specialties are able to provide cosmetic surgery, and some specialties provide it in certain areas exclusively. Other specialties encompass other parts of the body or most of it. So, but there are different specialties, and but we all provide cosmetic surgery, and we don't refer to it as plastic surgery anymore.
Absolutely, and there's a reason. I'm kind of leading you into that. There's a different way of doing cosmetics now. Do you want to talk about that a little bit?
Well, with the technology advancement, there's so many newer and better, less invasive procedures that are being done, and I think most people are more leaning toward less invasive procedure who wants all the downtime and all the scars.
Absolutely, and it's safer. There's less downtime, as you say, less recovery time
involved,
less scars, just a lot of things. Now, even the surgery itself is less and less quote quote plastic. It's actually more natural surgery, less invasive. And since you're the surgeon, do you want to talk about that a little
Sure.
bit?
What we try to do nowadays is we try to do the least possible to obtain the results that, or to meet the expectations of the patients, and to obtain the results that we're looking for. So what we try to do nowadays is we proceed in such a manner that we try to minimize the extent of the incisions. We try to minimize the invasiveness of the procedure. And they're so neat nowadays that we stay away from areas that usually used to represent the complications associated with plastic surgeries. So nowadays we refer to as a lot of modified procedures, and what makes them really nice is the fact that there is less downtime. They're able to be performed under local or anesthesia or with IV sedation, and in the comfort of an office, and the patients are able to immediately go home after the procedure, and they're totally comfortable, and they're back to work usually a few days later.
Which is quite amazing.
It is.
And the other thing is the paradigm shift that in the old days, everybody knows that surgeons like to cut, and here you're going to try every method before you actually cut, and when you do cut, it's very minimal. Is that a good summary of what we've heard?
Yes, it is. Yes, it is. It's exactly right. And, we try to address the concerns of the patients, and many times those concerns are not addressed with surgery, or they have to be supplemented with other alternatives other than surgery. For instance, an aging face, we tend to lose volume. Our skin tends to get thin, And the texture of the skin changes also. It tends to sag, and you lose elastic fibers, collagen. So then when we address these concerns, we not only have to perform sometimes some surgical procedures to do a little lifting, but we need to replace volume, and we need to address the texture of the skin, so we need to do skin resurfacing. All these things combined can get us the results that the patient is looking for, which is a more youthful, fresher looking face.
And sometimes the results are better.
Yeah, absolutely. They've done a lot of studies in the cross-cultural studies. That's what I was trying to say. And the one thing that is consistent across all cultures, beauty-wise, because some cultures like many different things, but the thing that is consistent across all is health. That if the person looks healthy and youthful, then that is what is considered beautiful. When we come back from commercial break, we are going to talk more about how you can, what procedures actually get that youthful and beautiful look from a healthy and youthful in a healthy and youthful manner. And don't go away. Make sure that you listen to some of these wonderful commercials that are available for an obscene profit break, and we will be back right after this.